So we are going to see about the uh, presentation part and what is the common presentation of it. So there are different types of presentation. What is meaning of presenting part? The presentation is the fetal part that occupies the lower pole of the uterus. This is so normally the presentation can be anything. That is which part which is present at the lower. This is this part. Which part present at the occupies the lower pole of the uterus is called as the presenting part. And the presentation can be anything. It may be cephalic, podalic, but normal one it is the cephalic. Near about some 96.3% it is the cephalic end is present, and the remaining that is the lower pole, that is podalic pole, that is breech presentation. It is which one is abnormal, that is 3.2%, and the shoulder and others, that is 0.5%. Or there may be some all times there may be compound presentation or partial presenting. Different types of the presentations are there. So this vertex presentation, so which one is the normal? Vertex presentation can be of various types, which is again classified according to the position of the occiput. It being, so it may be right, left, or transverse and anterior or posterior. So then it is the LOA, that is left occipital anterior. So that is what we see this. So if you classify this into anterior and posterior, so when occipital part, it is the present on the left side and anterior, then it is LOA. If this is the occipital part, if it is present on the posteriorly, so that is left occipital posterior. So if it is present on the right side, so right and posteriorly, then right occipital posterior. If it is present on the left side, then and anterior side, so that is right occipital anterior. So these are the difference, or sometimes there may be a transverse lie also. So that is what we see in this middle one. So that is called as a right occipital transverse. So the occipital anterior position is the ideal for the birth. That is normal. Occipital anterior position is ideal for birth. So that is of the types of vertex presentation that you have to think about it. Then next one is the Dawn rule of fourth. So what is the meaning? Whatever the basic investigations which are done during the antenatal care is called as a Dawn rule of fourth. So what it includes? So it includes the blood hemoglobin examination. Blood hemoglobin that is tested, and normal it should be about usually that is it is about 10 gram percent. And the second one that is important, that is ABO-RH blood group. ABO-RH blood group A or B or O or AB blood group is normal. In 95% in India, the females are RH positive, while that of in the 5% cases, the females are RH negative, RH incompatibility for that what is the required for blood group. Blood group. And next one is that is what we are required, the blood VDRL. Blood VDRL, then the post breakfast blood glucose that we have to do it. And then next one is that is we have to do the urine analysis, that is from the midstream of urine for and why we are doing this, so to see if there is a protein, sugar, and pus cells, if they are present, then to rule out all these things, what we have to do these basic investigations. So that is called as a Dawn rule of fourth. And next, that is what is most important, that is Dawn rule of 10. So what is in this Dawn rule of 10? So it includes the what is the basic things that should be. done. So first one is that is the 10 AMCs, 10 AMCs, then the 10 kg wedding should be takes place during the pregnancy. Then for during the pregnancy, the 10 hours rest and sleep is important. Again, the afternoon sleep is also important. Then HB, that is 10 gram HB. Then for the immunization purpose, so 2 doses of injection TT by the 10th month that should be given. That is the immunization, and 10 hours in labor for priming, and less than 10 hours for multi. And whatever the Apgar score of the baby should be 10. That is the rounding of 10, and 10 months of breastfeeding and infant immunization by the 10 month. And again, what is important for the downstream of 10, that is it is a downstream of 10, it is a pictorial calendar, which is in the which should be in the regional language, which is handed over to the pregnant lady. And whatever it, in that, whatever the 10 checkups, 10 ANC checkups 10th week after, we have to educate her on the steps that she has to follow during the pregnancy. Then then we have to give the proper food education to the female. Means that is what is the food she should be eat during the pregnancy. That is the food chart. That is whatever the food which is available in the local market, that we have to advise to the female. Then whatever the home resources which are available, food within the chart, that we have to advise to the female. Then whatever the misunderstanding regarding the pregnancy, that is what diet she has to take it. Some females say that she has to eat double as she is pregnant. But what is the main important? How much she is able to eat, and that is that she feels fulfilled that much food that she has to take it. Then afternoon rest is more important. 10 hours rest is important and sleep, but afternoon rest is more important. What is how much it is about some 2 hours is necessary throughout the pregnancy, and what is the reason behind it to get the weight during the pregnancy, and the total weight gain, it is about the 10 to 11 kg that should be takes place. Then 10 hours rest and sleep is important. And oral iron folic acid supplementation is also needed during this needed. And as we know that injection TT is to be given the first dose at the 18th week of pregnancy, and the second dose is at 24th week, 24th week from the uh, from from the first one. That is the, and how much it is 2 ml disposable syringe should be used. That is the immunization that we have to follow. And if that sometimes if the female is having other problems, like if she is having some constipation, then the medicine that we have to give to the female, and the avoid of sexual intercourse throughout the pregnancy to prevent the abortion and the preterm labor, that we have to advise to the female. And if other health education, then what is important, that she is made aware of whatever the high risk pregnancy, that is what are the danger signals which are present, that is if there is a vaginal bleeding, swelling of face or finger, or if there is a continuous headache, or there is a dimness of vision, and if there is a abdominal pain, or if there is a persistent vomiting, fever, dysuria, or passage of fluid from the vagina, or if there is a marked change in the fetal movement, so that she can immediately get informed to the hospital, or she immediately gets admitted to the hospital, or give information regarding it. Then in that situation, education on labor is given. Then infant immunization is also given properly. So that is the advice is given. So this is what is done. That is called as a dawn rule of 10. Then uh, there may be sometimes the one or more than more than one pregnancy occurs, then it is a twin pregnancy. So in that situation, two or more fertilized events, fertilization events take place. Single fertilization followed by splitting of the zygote, or there may be some combination of both can be takes place. So that is comes under the multiple pregnancy. So what we see that twins, in that twins, uh, there may be monozygotic twins or dizygotic twins. So in monozygotic, what we see in this diagram, that is one ovum and one sperm is there. No intervention of chorion and amnion is there. So monozygotic. While in case of dizygotic, two ovumes are there and two separate ovumes are there. And what we see the difference over here. That is here no intervention of chorion. While in case of dizygotic, that is related with that of fetus, what we see that fetus, then amnion, then chorion, then again chorion, that is two chorion and amnion. That is when one or more than two are fertilized, then it comes under the if there is more than one pregnancy fetus is there, then it is a twins, and it is again divided into types. Two types. It may be monozygotic twins or dizygotic twins. So that is what we have seen about the introduction of the obstetrics. In that, what we have seen the antenatal, in that mother normal part, what we have said. So thank you.